Hello, my name is Dr.Jana, and it's great to join you again, courtesy of Doral Juvenile Group and the Safety First brand, to be able to bring you my pediatric and practical parenting advice on grooming babies. When it comes to fingernails, I have to admit that I and my husband knew that our daughter, our firstborn, needed her nails cut as a baby because she'd wake up in the morning with scratches on her face, and ideally you don't wait until then. But it is worth knowing that babies' fingernails can grow incredibly and inconveniently fast at a rate of even 0.1 millimeter per day. Now, I would not ordinarily know that, but I have looked up the information and that's what I'm told. For you and me, what that means is you're going to want to pay close attention to your baby's nails, keep them short, and also avoid sharp edges. Using a baby-sized nail clipper, baby files, or even a baby scissors where you can clip the edges of the nails is really useful to have in hand. Trying to clip the nails of an active and engaged baby is an uphill battle at best. Whereas if you wait to find a time sitting in a nice rocking chair after your baby's had a bath perhaps, or maybe when your baby's getting drowsy or a little calmer, can go a long ways towards making the task easier. In fact, I find it easy to wait until a baby's sleeping when you can cut their nails, or perhaps drinking where they're distracted and they're calm and relaxed, and cut their nails when they aren't struggling and they're not trying to get their hands away. That can help alleviate the fear that all new parents have about accidentally clipping a baby's fingers when you don't mean to. Now, moving on to the next basic grooming task that we're faced with and that most parents are well used to dealing with for themselves, but find a little bit challenging when they're trying to figure out what to do for their babies, is skincare. Most newborns are born with dry skin, and if you think about it, bathing in fluid for 9 or 10 months can actually dry out the skin considerably. And while it's an uphill battle to try to patch down dry skin once it's already flaking off, it is fine to take, for example, a baby brush or something of that sort and get some of the sloughing skin off. Do feel free to use moisturizers or a petroleum jelly or something in areas that seem particularly dry, and realize that water can actually have a drying effect on baby's skin. So especially before your baby's the age where they can crawl around and really get dirty, just focus on bathing your baby or cleaning areas that get dirty, usually around the mouth and around the face and in those neck folds from drinking and from food once your baby starts eating solid foods, and obviously in the diaper area. Target those areas, and if your baby has particularly dry skin, consider backing off the number of times that you bathe during the week. You really don't need to do much of anything about Cradle Cap because it does tend to go away on its own. If it's particularly significant or severe, by all means have your baby's healthcare provider take a look at it. But if it's really bothering you and you want to do something about it, it is again possible to take a soft bristled brush or even a little soft baby toothbrush and use a little bit of baby oil and massage it, or baby shampoo, and massage it into your baby's scalp and use the brush to gently get some of those flakes to go away. Again, really the only reason to do that is if it's bothering you, if you're about to get your first family photo taken with your baby and you don't want those flakes there. But otherwise, take a step back and don't worry about it, because really you can focus on keeping those nails short without any sharp edges, making sure your baby is bathed as needed, and keeping their skin moist. But don't worry so much about the flaky skin. Again, my name is Dr.Jana. It's my pleasure to join Safety First in bringing you these safety tips and practical tips for parenting. You can also find more of them on the Safety First Facebook page and website, and also in the Safety First newsletter.